Medicare and Medicaid patients prescribed opioids for chronic pain could soon be cut off, and hundreds of doctors are opposed.
Just cutting the pill is not the solution. It might even worsen the situation.
The Center for Medicare and Medicaid proposed new policies for 2019, restricting patients to an opioid dose level equal to 90 milligrams of morphine a day. Dr. Ehrman Owari and over 200 other medical professionals signed a letter warning the agency the one-size-fits-all approach could have dangerous consequences.
People with this complex set of problems will be abandoned, and they'll be either bedridden, or a lot of them will have adverse medical outcomes. There will be adverse psychiatric outcomes. There will be increased suicide among them.
And even doctors who helped develop the CDC guidelines on opioid prescribing disagree with the proposed policy, including Dr. Jane Valentine.
The CDC guideline does make note that if somebody's already taking opiates, those rules don't really apply because they already are taking opiates.
At least 500,000 Medicare patients received opioid doses over the proposed restricted amount in 2016. And Dr. Valentine says, unlike the CDC guidelines, the CMS policy is too cruel to these patients.
If we just tried to reduce everybody who's already on high doses of opiates to the dose level that the CDC is recommending, you'd have an awful lot of people who are either suffering a lot or going to the street to get heroin.
And since many states have already enacted laws to reduce opioid prescriptions, Dr. Ehrman Owari says the policy would only hurt those who legitimately need the pain pills.
People who are really dependent on opioids because there is no access to treatment, they will gonna move on to heroin. So only set of people this going to affect is a lot of people who are stable on these medications.
1/3 of Medicare Part D patients were prescribed an opioid in 2016, and in a statement, CMS said the policies are meant to reduce the number of patients becoming addicted while maintaining their access to care. The policies are expected to be finalized in April, and Dr. Ehrman Owari says if the agency doesn't make the changes he's advocating for, he'll continue to speak out.
These patients, after abandonment, ends up in somebody's clinics. As a physician and sitting in the clinic, that is my problem.